Post-traumatic stress disorder, PTSD, problems. 1. Exposure to actual or threatened death or serious injury that resulted in an intense emotion response of fear, helplessness, or horror. 2. Intrusive, distressing thoughts or images that recall the traumatic event. 3. Disturbing dreams associated with the traumatic event. 4. A sense that the event is recurring, as in illusions or flashbacks. 5. Intense distress when exposed to reminders of the traumatic event. 6. Lack of interest and participation in significant activities. 7. Symptoms have been present for more than 1 month. Goals. 1. Reduce the negative impact that the traumatic event has had on many aspects of life and return to the pre-trauma level of functioning. 2. Develop and implement effective coping skills to carry out normal responsibilities and participate constructively in relationships. 3. Recall the traumatic event without becoming overwhelmed with negative thoughts, feelings, or urges. 4. Terminate the destructive behaviors that serve to maintain escape and denial while implementing behaviors that promote healing, acceptance of the past events, and responsible living. Solutions. 1. Assess the frequency, intensity, duration, and history of PTSD symptoms and their impact on functioning. 2. Verbalize an understanding of the rationale for treatment of PTSD. Discuss how coping skills, cognitive restructuring, and exposure help build confidence, desensitize and overcome fears, and see oneself, others, and the world in a less fearful and/or depressing way. 3. Learn and implement calming and coping strategies to manage challenging situations related to trauma. Learn from stress inoculation training such as relaxation, breathing control, covert modeling, that is, imagining the successful use of the strategies. 4. Explore the self-talk that mediate trauma-related fears. Challenge negative biases and generate appraisals that correct for the biases and build confidence. 5. Identify, challenge, and replace biased, fearful self-talk with reality-based, positive self-talk. Explore the self-talk that mediate trauma-related fears. Challenge negative biases and then generating appraisals that correct for the biases and build confidence. 6. Identify fearful self-talk and create reality-based alternatives. Review and reinforce success, providing corrective feedback for failure.